to order. All right. We'll start the meeting with the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Welcome, everybody, to the November 17th meeting of the Board of Health. We will review last month's meeting minutes. Has anybody had a chance to look at those? I hope. Any reviews or changes that anybody has? No. I'll look for a motion to approve those. And a second?
I'll second that.
Okay. All in favor?
Aye.
They will be approved. Thank you all. And we'll start with some announcements for everyone. There have been some new appointees to the Board of Health, and we welcome two people who will be starting in January. Joan Capuzzi, who is a veterinarian who has actually presented in front of the board, I believe, in the last year. Looking forward to her starting and joining us in January. And also Kathy Durr will be joining us in January as well. And with us tonight, starting his term on the board, is Amit Khanna. And I welcome Amit to the board, a very good thing, a friend, as well as a very accomplished surgeon. And welcome, Amit, to the board. You have a couple of introductory, just a couple of things about yourself that you could just share with us. Thanks.
Sure. So I am a colorectal surgeon and a general surgeon. I run the digestive health programs at Chestnut Hill Hospital and for community health systems, multiple hospitals in Pennsylvania. We've lived in Radnor for 5 years now. I have 3 boys in the schools, and couldn't be more happy and honored to be here with all of you, and I hope to get to know all of you very well soon.
Thank you. I know Amit also has a strong history in public health. I think it's education and public health, correct? Terrific. Thank you for being on the board and joining us.
Thank you.
Larry, we'll go to you for the health officer's report.
Thank you, sir, and good afternoon to the board and to the residents that are watching on TV. Before I give my report, I have to also welcome Dr. Khanna. Welcome to the Board of Health.
Thank you, Larry. Thanks for your support.
And I'd be a bit remiss if I didn't recognize these 2 young people to the left of me. Their report, I was so impressed with that report, how it was formatted and written. It's a testimony to the school district. Very, very nice job. When you look at my report, you look at my normal activities. I don't know if many of you know that my boss has been deployed. He's just recently returned, so my activities are a little on the light side, as we had to split up some of his duties during that time period. But we did 14 food inspections, 9 bathing place inspections, and then quality of life issues, of which we had 3 dog bites to humans, 1 food facility that was operating without a license. We had one animal that had a wound of unknown origin. We had 2 raccoons that were acting strangely. 1 did test positive for rabies, and a complaint of bed bugs, which is rare for us in this area. We had several meetings, workplace safety committee, budget meetings. I'm a part of the Philadelphia Area Food Safety Task Force. We had some meetings, and we had a training session last month. Myself and Jim Doling and George Smith, who is the emergency management coordinator, attended a doning and doffing training session for PPEs for Ebola on Saturday the 8th, which was very, very interesting and worthwhile attending. We've been working on a township response to serious contagious disease policy for employees, and several staff citizen concern meetings. In your packet, I think you should find some facts about Ebola. a flyer regarding enterovirus D68. As many of you may be aware, Delaware County Council has a wellness van that goes from municipality to municipality. We have had it here at the township, and we're going to try to get it back again. What they do is they check for things like blood pressure and light screenings. The weather's getting cold now, and what we have in your packet and most of these things we have on our website, the warm line, which is where residents can call if they're having problem with heat. We have information regarding the Delaware County State Health Center, which is in Chester, and the services that they provide. As many of you know, we have a drop center here for residents to get rid of their prescription drugs that are no longer needed, and you can drop them off here at the Township building, down right outside the police department down on the bottom level. Radnor Township will be having a health fair. And on your packet, Radnor Township Workplace Safety Committee on Wednesday, March the 18th, here at the Township building in this very room. It's going to be open to everyone, free admission, door prizes, free refreshments. And we'll be talking more and more about that in the planning process, and we hope that the Board of Health will have a table. Also in the packet is some information regarding LIHEAP. From time to time, there's people who have problems maintaining their house warm during the winter months. There's a program called LIHEAP that may be able to help. Mr. Chairman and the board, so ends my report.
Thank you, Larry. All right, and we'll move into some old business, and I think we'll actually kind of go out a little bit out of order here and start with, if Linda doesn't mind, just making a quick comment. I know there was national news this past week about the safety and the non-safety of detergent pods and the consequences of some sickness and death from them.
So I gave a report several months ago regarding the laundry pods because we had seen in local emergency departments a couple children who were very seriously sickened by biting into the pods themselves. So I gave a report on that, and more recently, the Philadelphia Inquirer on November 10th had an article, if some of you read, regarding the poison center across the country. They've logged 17,000 cases of children being sickened, and I think with a couple deaths noted. So it just, underscores the importance of ensuring if you have the colorful laundry pods in your home to really ensure that they're stowed away from children, grandparents especially, if you're watching children, to really get them from under the counters and put them in a high place so kids cannot get them. The problem being is once they bite into the packet, they're sealed very tightly, and the soap and detergent shoot down the throat into the airway and cause some very, severe respiratory and neurologic problems very quickly. So that's all I have to report, but it just, we're a little ahead of the curve with that, so it was kind of interesting to see that in the paper.
Thanks so much for that. And also your last month, your report on Ebola was very complete, and I think I've seen some stuff on TV and the news that doesn't even compare to the information that you gave us last week. I appreciate that. All right. Number two we spoke of last week was speaking about making Wayne and a cigarette-free zone on the outside areas. The Wayne Business Association meeting, I think we kind of got unlucky that our meeting was right after theirs, and their meeting is coming up next week. So I believe we'll, at some point, I'm going to attend their meeting and speak with some people there about that kind of thing, to see, kind of get their opinions on this. Marianne, have you had any other contact with anybody else in the business association or local business owners?
No, but in the minutes, it says that I just spoke the most regarding I think Chairman Wishner wants to go with you to that. I don't think it's me, but I just had said that I think we have to go that route so that we respect the fact that this is the way they make their living.
If anybody else on the board has input on what their thoughts would be about, how I would present this to some of the members of the Wayne Business Association, whether it would be something that we would discuss as sort of eliminating the whole street storefront area as being a smoke-free zone, or is it just the restaurant type of areas and the areas in Wayne that people are sitting and trying to enjoy food and things like this to make it a little bit more health conscious? So I think that'll be a discussion that both the chairman and I will have in the next week or so as we will attend the meeting in the November meeting of the Business Association.
Dr. Foreman, when and where is the meeting?
I don't have it on me.
Okay.
Is this coming? I think it's this coming Thursday, this week or next Thursday, the 20th. I think it is. I'll find out for sure for you.
Okay.
The 20th, this Thursday.
Next Thursday, Thanksgiving.
Yeah, that's right. So that's probably this week. I have it on my calendar somewhere. I was
Okay, thank you.
accessing iPhones and looking at my
I don't want to interrupt,
my
but
agenda.
it's 7:30 in the morning at Eastern University.
Thank you.
So
Thank you very much. I knew I had it on my phone somewhere. I don't know if there was any other old business, but just to kind of also just thinking about in the past, we have done these tables where the Board of Health attends local events to sort of get the community involved and see what they want us to deal with on the board. And I believe I think, have we all sort of done this? I'm not sure if you've certainly done it, right? Yeah.
Maybe I did it in the summer.
Right.
You know it?
What else? It's okay.
Report back to what we were doing.
Last year, I think we all decided to pick an event in the township, and we went. I didn't have a table. I think I was at the Fall Festival.
To the fall festival.
Okay.
And then, but I pretty much go to mostly everything.
Okay.
And here, but this would be a formal way, but Mr. Doling was saying it's mostly township workers, but his concern, or his great idea, I should say, is to encourage the school district to see if the students will come from the high school because they have open campus and they could get free pizza. So I said, well, the reality is the free pizza you could be eaten at a house and home. But that's a nice idea if the school district is in agreement with that. You wouldn't want them all at once, though. That could be interesting.
So, yeah.
Is it typically on this property?
Yes, ma'am.
It is here, yep.
I mean, while there's a lot of space, it also is rather remote.
Right, for people to come and see it. But I think that, as in the past, we'll probably set up a small area for people to come up and talk to us about things that they want the Board of Health to deal with. I think it's always a good way to get the community involved in what we can do for the community to help us out to make some decisions about what we discuss and deal with in the future. Okay.
And Dr. Foreman, as a reminder to the public, they can always email us. We did institute that on purpose, so the feedback we could get direction from the township. That's what we wanted from the citizens.
Sounds good. Any other old business that anybody had to bring up from last meeting? Anything else? Okay. Anybody have any new business? I don't think there was nothing listed as new business today. Okay. Couple of just things that were interesting in Larry's packet that I think should be brought up as new business or at least discussed as announcements in this meeting would certainly be getting your flu vaccination, which is we're still in the height of flu, well, not even the beginning of flu season, but certainly the height of getting your flu vaccine season. So I encourage everybody in the community to find someone to get your flu vaccine, whether it's your physician, a local pharmacy, or a local a minute clinic or a doctor's urgent care center. Flu vaccines are relatively painless and have very few side effects and are somewhat effective against the flu and certainly will protect you this season. Second thing that we have to remind people of in this time of the holidays and time of the year when there is some issues with depression and other life events. We have to remind people that there is help out there for people who have issues during the holidays and all times of the year. And the Delaware County Crisis Connections team has a line called the Warm Line where you can call there Monday through Friday, 6 to 10 p.m., and then also on Saturday and Sunday from 1 to 7 for just confidential support and an ear on the phone to speak with someone if there is any type of issues at home or issues that a person can't deal with. And that number is 855-464-9342. So two important things for this winter time to think about. Anybody else with any new business or anything that we've been planning to deal with that anybody can remember that I'm missing? Yeah, that's a good point. I don't have all the information I need to talk about this today. I don't see adults too often over 65 since I'm a pediatrician. But the trivalent vaccine had been available as the only choice for the past 15 to 20 years. Obviously, a good option considering it covers 2 strains of the influenza A and 1 of the influenza B. The quadrivalent or the 4-strain vaccine covers another strain as well of the A. I believe both the trivalent and the 4-strain both have the H1N1, the old, a few years ago, the swine flu version in there, which has been the predominant flu strain for the past 3 seasons, I believe, maybe 4 seasons. So it is a protective vaccine. There's also some confusion too, I think, because there's not only available for the elderly, the trivalent and the quadrivalent vaccine, but also the higher dose vaccine, which is supposed to give some extra immune protection to the elderly. So I think that might be something I could certainly take on for the next meeting, for the December meeting, and make a small presentation about the best ideas. But I think that no matter what we say at the next meeting, I would still encourage people to get either the trivalent or the quadrivalent as soon as possible.
When I was doing my flu talk last month, the CDC has an excellent section on defining the differences between the vaccines and who should get what. So that might be a resource for the public to look at.
I was going to say this, we're starting to head towards the time of year where everyone on the board in the past would think of things that they wanted to achieve for the coming year and come up with different topics, and that can be something that ends up, just for the newer board members as well, that can be something that ends up being a 15-minute presentation here. There's also, we had quite a number of Radnor Health Matters that we got together with Jim Doling. It's a program that's aired on the Township, I think it's on the Township channel. And, I know I had done one on rabies a while ago and ticks and Lyme disease. And certainly whatever your area of expertise is, that's a good opportunity to, I think they run about 30 minutes or so, and they really are very helpful. But I know this is the time of year we start thinking about what we want to achieve for the coming year. So, I think that it's something we should all be thinking about.
Anybody else with any new business today? And there's certainly no public participation today. We're going to get Amy.
I don't have new business, but and this might be an update from Amy Wishner, but I know she was speaking with, I believe, some of our representatives to the police force about the walkability and the trails and the access. Do you have any updates on that? Did she give you anything on that?
Nothing other than when the gentleman presented to us with the park updates and the things like that, but nothing since then. I don't have anything else for us. Yeah. Okay. A brief meeting today. No public participation. Anybody else have any other announcements prior to adjourning for the week?
Yes, on behalf of the Board of Health, I'd like to welcome the President of the Commissioners, who's here today, and wish everyone in our community a happy and safe Thanksgiving.
I appreciate that, too. If there's no other business to be discussed, then I will call my very brief meeting as the chairman to a, to a close.
Maybe they did that on purpose.
Maybe. Thank you.